there's a lot of things we can do to heal, but I think the most important piece of this is the vulnerability to own that error. And so, there's, and Brene Brown she kicks this off the charts, right? Has anybody seen the Brene Brown TED Talk on vulnerability?
Yes.
So I would strongly recommend you look at that. And in fact, I've got a couple of her quotes here. But we have to do this. We did this with our clinical teams. We talked about vulnerability. Because I don't know about your profession, but the places I work, people pride themselves in their high level of skill and ability. And then to say, I made a mistake, and to share that mistake is really, really difficult. But we're going to talk about what vulnerability is and where it leads us. So the alternative then is shame. Right? So shame is when we hide ourselves in secrecy and I mean, we can understand the feelings of shame, right? That I've made a mistake, I'm a high performer and I've made that mistake. And we feel either internally blame ourselves or blame others for why that error happened. And vulnerability we're talking about is talking about the error. Being able to be open and curious about it and dig deeper and figure out what happened. And it is personal. It is personal. And that doesn't make it any easier because it causes us to reflect about ourselves and our abilities. And so the challenge is that when you stay in shame and can't move to that vulnerability, to be open to explore and look at it, you hide in the darkness. And you can't often find a way out the other side. And it can lead to really destructive behaviors. So it's through going and really reflecting and being vulnerable that will shine the light in those dark places. So we're going to talk a little bit about more what that is. But the quote that I really like is around vulnerability is not weakness. Right? We see people that have a chink in their armor, we think that's a weakness. But if we talk openly about that and how it got there and what we're doing to fix it, in fact, it shows a great amount of strength. So I like what Brene Brown says, vulnerability is not weakness, and that myth is profoundly dangerous. It's dangerous because it sends people to shame. Vulnerability is the birthplace of innovation, creativity, and change. So it's hard though, because you're putting yourself at risk. You're putting yourself out there on the line. And your desire is to make the problem disappear, but it doesn't. Nothing goes away without shining a light on it. So when you have vulnerability met with empathy, then it can get you to a whole different place. So what's really interesting, when we look at shame is the fear of disconnection. Shame is the fear that if you tell somebody something, they're going to think you're not good enough. You're not worthy. That's your fear with shame. And so it drives certain behaviors, but it's the concern of disconnection. But vulnerability, of sharing and opening and sharing with others, can lead to connection. So the hard part of that is met with empathy, and we've got to create conditions where we can receive with and give empathy when that error happens. And so for us, when we had that initial debrief, the empathy, I'm really sorry, and we're here, and we know that you feel crappy. And you all feel crappy together, but we're here beside you. We'll work with you to figure this out. And that empathy really leads to those connections within that team and outside of that team. And so it's a really powerful way of moving forward as as an organization and as a team, but also with recommendations. When you're creating recommendations in this environment, do you think people are bought into those fixes? Absolutely. Absolutely. They're committed to those recommendations because they've lived the other side of it. So you have some great champions if you can do and create an environment like that. And so by having that empathy in which you can allow the teams to be vulnerable, to talk about those errors, to talk about their thoughts and feelings, we can start in a new place and have a growth opportunity as an individual and as an organization, right? Instead of feeling like you're stuck. So we talk about care, share, and repair. You've heard of blame and shame, but we talk about care, share, and repair as part of our model for learning. And so what that requires is that connection, the vision to learn, and the opportunity to heal. And those all are important to us. It's just not about figuring it out at any cost, right? We work in an environment of care and compassion. And how do we get there? And so we recently had a very significant incident, a violent incident with a patient assaulting 2 staff members. And so we're still on this journey, but we've made extra efforts to go through and ensure we're all connected with a common vision. And we provided an environment where people can be vulnerable and say, we had a security officer say, I feel like this is my fault because I should have known. And so one of the parts of the exercise when we were doing the review and the timeline was saying, okay, let's talk about our safeguards that worked. Let's talk about the things that went well, because we did a lot really well. And so, somebody got up and said, well, I think, security did this, this, and this, and named off 4 things. And I think they're really the heroes in this story. And people applauded. And it got me very emotional. That security officer, and there were 2 that were involved, they were in tears. They thought they were responsible. So that connection that we gave by giving people an opportunity to talk openly and honestly and confidentially was really a powerful connection to moving forward. And then the learnings from that and the improvements to our already robust system has really created a different atmosphere. And the healing part, well, we're still working on that. We're still working on that. We have a nurse that hasn't been back to work. We've got the security officer who just returned to work. But we're very conscious of where we put them and how we work with them. But the whole team, even the people that didn't get hurt, feel this responsibility. And how do we help them heal? And it's really about positioning this as an opportunity to learn. The legacy from these kind of incidents is really about learning. And that creates a whole powerful spin. Instead of who got hurt, we're creating a legacy of learning. And it just gives a whole different tone to what you're doing and why you're doing it. So we take these cases and we share them at our quality of care committees. And they sometimes get reported to the board. But part of that is having the leaders talk about this openly for the learning. Do you have a question?
Yeah, I did have a question. It sounds great. When you were putting this into your organization, or it was growing, was there already a culture fit for it, or did this help change the culture, or which way did that work?
We really drove the culture change through this incident management system and toolkit, our process. And it was not an easy sell. There was a lot of trust that had to be created and mutual respect to get where we are, and we still have a ways to go. But these are stories that are told on units and programs after reviews. They share them. We have something called artichoke rounds. And I remember when we started it, it's really, artichoke rounds are peeling back the layers to get to the heart of the matter. And it's really about that heart, that connection. And so they're really interesting because We have grand rounds and medical rounds, and, they're very technical. This isn't about the technical piece. This is about the people piece. And so we have teams that come and share stories of incidents and errors, and very reluctantly, and we try and describe this as an opportunity to share our failures, fail forward, and the feedback that those teams get in terms of the courage it takes to be vulnerable, and the faith that people have in their skills and abilities for coming forward, and the support that's generated is really a remarkable shift that I don't think anybody was really ready for. So we have opportunities to do this at several points, and we're still working on spreading that and taking it back to units. But it really does create a culture of care. And to me, that is the secret sauce. That is your magic bullet. That is what makes people do things for the right reason, not because they have to. Because they care about, you care about them, they care about you, and they care about their coworkers, and they care about their patients. But we have to lead and show it. So this is another example, and I used this the last time I did this talk, but I think, I don't know if there was anybody here from the last talk. We're a regional center, so we have a regional cardiac program, so we draw from wider than just our community. We're a regional cardiac center, regional mental health center, regional cancer center. And so we have one of the top teams in the province, if not in the country, with our cardiac team. And so this